Kasaragod എല്ലാ പ്രേക്ഷകർക്കും മെഡിട്രാക്കിലേക്ക് സ്വാഗതം. ഇന്ന് മെഡിട്രാക്കിൽ അതിഥിയായിട്ടുള്ളത് മാംഗ്ലൂർ ജ്യോതി KMC ഹോസ്പിറ്റലിലെ പീഡിയാട്രിക് ഡെന്റിസ്റ്റ് ഡോക്ടർ ദീപിക പൈ ആണ്. മാം വെൽക്കം.
നമസ്കാരം.
മാം, pediatric dentist, that department, what is the importance of pediatric dentist?
Pediatric dentist is basically a dentist who can deliver dental care for children. We all know that children are very scared of hospital, so getting them for dental treatment becomes very difficult. So we as pediatric dentists, we are qualified and trained to handle behavior of children, and we insist that children should visit pediatric dentist frequently so that they become familiar with our dental setup and they start to cooperate better. So the biggest challenge in delivering any kind of dental treatment, whether it is filling, root canal or removal of teeth for children is difficult because they are uncooperative. Most children don't like any kind of unpleasant experience at all. So when they visit us frequently and they get familiar with our setup, what we tend to do is we build a rapport with them, we understand their behavior, and accordingly we treat them for their disease, dental disease. So pediatric dentist plays a very important role in developing that kind of rapport with children, so that whenever they have any dental problems, we can deal with them in a better way, more pleasant way. Parents also will be very happy if dental treatment is delivered to children without any unpleasant experience.
See, as we know that by birth there is no teeth for children. Okay, then at what time they should visit a dental? That means at what time they should visit a doctor?
So at birth, some children have teeth. Very few people, about 1 in 10 or 1 in 100 may have teeth at birth. Now these teeth can cause problem during feeding and may get swallowed and can cause any complication. So we as pediatric dentists, we also remove these teeth so that the child can feed better and mother and child are both comfortable. Now when the teeth erupts into the oral cavity, that is, maybe some children get their first teeth by 6 months, some children get their first teeth by 1 year. So generally by the first birthday, all children will have one or the other teeth in their mouth. So what we recommend is that parents should visit the pediatric dentist as soon as the first teeth appears in the oral cavity. Now what we do during this visit is we tell the parent how they can clean the teeth. Because the most important factor that can cause any dental problem, whether it is cavities in children or later on it could be any other dental problem, all of that starts because we don't clean the teeth properly. So we tell the parent how they can clean the teeth, and even with 1 or 2 teeth in mouth, we teach them how to clean the teeth. Because
even it is 1 or 2 teeth in mouth, that time itself we should start the cleaning.
And that is very difficult to do for parents, because they have
actually parent doesn't have any idea about how to clean or properly or scientifically how to clean the teeth scientifically.
So different dental aids are available. If there is 1 or 2 teeth, the mouth is very small, the parent is very apprehensive, can I put my hand inside the mouth or will it cause any infection? So we tell them what dental aids can be used to clean the teeth. There are dental wipes, there are finger brushes. The other challenge most parents feel is that the child is moving all the time, the child is so small, how can we make them stand and brush for 1 or 2 minutes? So we as pediatric dentists can tell them different positions that the child and parent can take so that they can accomplish toothbrushing more easily, more effectively, so that they don't cause any dental caries for the child.
See ma'am, regarding brushing, I think that parents have an idea, but see, when you just inform that when the child has 2 or 3 teeth, that time what kind of brush we should use, whether it is needed brush or just using finger we can clean the teeth.
So what I generally recommend is that parents should brush the teeth, whether it is 1 teeth or 2 teeth, and especially if the child is being fed in the night and put to sleep, I always say that you brush the teeth, wipe the teeth and put the child to sleep. So usually when small teeth portions are erupted, what we recommend use of tooth wipes. There is something called tooth wipes, so that can just be wrapped around the parent's finger and teeth can be cleaned with that. When more than 3 or 4 teeth are erupted and the child is grown little big, the mouth can open little more, there is something called as finger brush which can be inserted on the finger of the parent, on the finger, so they can easily brush and clean the teeth effectively.
Okay.
So these two things we usually recommend for children less than 1 year of age.
Okay.
So when child becomes more than 1 year, 1 to 2 years, they can use a junior toothbrush with small head, soft bristles.
Soft brush.
Yes.
Okay.
Yes.
See, ma'am, after which age onwards? That means which age group onwards the problems will be more, and when you are observing the teeth, children's teeth, then you can see that when you are observing that which age onwards you will get the problems are more complicated regarding.
So what happens is when the child is growing and he comes to 2 or 3 years of age, usually children go to preschool or a play school. Now what happens is parents have to pack some snacks and midday meals or something. So usually parents pack some food items like cookies or pastries or these kind of things which can cause cavity to them. And when they return back, by then there too much of time has elapsed from the time they have eaten, they have not brushed their teeth. So usually between 2 to 4 years we see that a lot of children have cavities, and this is mainly because of the snacking habit that is present in children as they go to school. When they are at home, even if they eat something, the parent is there after them to tell them go and gargle your mouth, which does not happen most of the time in school, because of which we see that there is too much caries. Another age group is at the age of 1 year or 1.5 years. So here what is happening is the mother is putting the child to sleep after feeding. Because the mother is also tired, she also wants to sleep, the child also has to sleep. So what the parent does is the mother feeds the child and puts the child directly to sleep without cleaning the teeth. Now the problem starts with this, where the child is sleeping with milk which is stagnating on the teeth, which causes something called as early childhood caries. So at 1 year it is because of improper feeding habit and no oral hygiene that is followed at bedtime. If you see the 2 and 3 year old age group, it is because of snacking at play school or preschool. Like that, when the child becomes 6 year old, most parents are unaware that there is a permanent molar which has erupted. The children have 2 sets of teeth. One is the milk teeth, which starts by 6 months, and by 2 years children have most of the milk teeth. But the first permanent molar erupts at the age of 6 years, and it is erupting right at the back of your mouth. So parents think that permanent teeth is coming only when the front teeth has fallen and come. So most parents tend to ignore oral hygiene or brushing at the last tooth, because the child is not cooperative by 6 years. Child wants to brush independently. Now parents are also giving them that autonomy that you brush your teeth. Parents are busy with the second child or their own household chores. So what happens is that the first molar which has erupted right at the back, there a lot of food gets accumulated and this tooth becomes carious. So the second age, first we said 1.5 years or 1 year, second is 2 and 3 years. The third peak of caries incidence we see is at 6 years. That is because of parents are unaware that the first permanent molar is erupted. Then onwards again you will see at 9 to 10 years, because there is an exchange of milk teeth to permanent teeth. So the milk teeth fall and permanent teeth erupt in its place.
One doubt, what is the importance of milk teeth?
Milk teeth, most parents think that when there is cavity in milk teeth, we can just ignore it, because anyway they are going to fall away. Now it is very important to treat milk teeth for few reasons. First reason is, when the teeth has cavity, children don't eat food properly because it is painful, and because of that what happens is the child's nutrition becomes poor, child's growth gets affected, child has pain and misses school very often, so it can affect their schooling and academics, learning. Also it can cause problem in their oral cavity to the extent that they may not be brushing the teeth at all because it is painful. Also, children who have lot of cavities in their childhood, they tend to be irritated all the time. Now these milk teeth, if they are filled at the right time when they have cavities, children tend to enjoy their childhood, grow well. Besides all this, the primary teeth has two important functions. One is to develop speech. Like I told you, 2 or 3 year old, when they have multiple cavities, their speech also gets affected. They can't pronounce the few words very clearly. Second thing is, this milk teeth has to remain till the permanent teeth occupy their space. In case these milk teeth are lost prematurely because of cavities, they become into pieces and they are gone away. So what happens is, the space that is required for the permanent teeth to erupt gets closed. So the milk teeth is like a shell which is keeping the space for the permanent teeth to occupy later in future. So if you ignore the problems of milk teeth, you are definitely going to ignore the child's permanent teeth. So definitely we see that when parents have not treated children with dental caries in milk teeth, we see a lot of them having crowded teeth in permanent dentition because the space has become closed.
See, ma'am, after getting permanent teeth, we can see that some children have the teeth are positioned in badly. In such a case, what kind of treatments are given?
Yes. So we can see that the child might have crowded teeth in permanent dentition at a very early age. Usually by 8 or 9 years, we see that the incisors, permanent incisors have erupted in a very crowded fashion. That is a definite indicator that this child is going to have malocclusion or crowded teeth in permanent dentition. So we can take necessary steps. So something like extracting the teeth at the right time so that the tooth can come into its proper place. Or we also see that some patients have different oral habits, like some children suck their thumb, because of which the teeth gets projected forwards. So these things, if we catch them very early, they can be intercepted so that the child does not have a very badly placed teeth or a very crowded or a very projected teeth, which most children tend to have. The other thing we can prevent malocclusion is by treating the primary teeth timely. Like I told you that if there is cavities and we don't treat them, the teeth are lost, the jaw becomes smaller and the permanent teeth does not have space for it to erupt, because of which obviously they will end up with crowded teeth or malocclusion.
See, another thing is accidentally happens. See, when fallen the children, that time what happened? Broken teeth. We can see that. What kind of treatment that you want? See, most probably in school or even home, we can see like that. See, that broken portion is there. Then even parents doesn't know how to keep that one properly. Could you please explain that one?
Usually children are very active individuals. They tend to run, they tend to fall. Now if it is a very small child, let us say it is a 3-year-old or a 5-year-old, now that means they have only milk teeth. And if they fall and the tooth is fallen out, we generally don't bother to put the teeth back. Or if the tooth is pushed inside, the tooth have the chance to come out on its own. But whenever a child has fallen, whether it is school or house, I will definitely recommend the parent or the teacher in either case scenarios to look for the teeth. Because we are assuming that teeth has fallen out. Sometimes the teeth can get pushed inside the jaws, and there are some cases where the teeth have been seen in the nasal cavity or in the throat or in the stomach. So these situations can arise. So if you have found a tooth, that means you are definitely safe. So at up to 5 years, we generally wait and see that the tooth can come on its own and things like that. But if it is a 8 or 9-year-old child and has fallen, again I would suggest look for the tooth or the tooth piece. Sometimes the tooth fractures in such a way that there is a small piece of teeth that has fallen away. If you find it and you even put it in water and bring it to the dentist, we can fix the same piece of the teeth back on the child's mouth.
That means that broken part put in water.
Simplest is drinking water.
Yeah,
Okay.
that's one enough.
In case you have found the whole teeth, this I'm talking if it is a piece of teeth.
Correct.
Just the teeth piece
Correct.
that you can see in the mouth. But sometimes what happens is
Whole-
usually when
yeah,
they
there is
play
a
in the
chance of,
playground, the whole teeth comes
will-
out.
okay.
And if you find that whole teeth, you can either put it in milk, take a packet of milk
Okay.
and just pop the teeth inside the packet, seal the packet and bring.
Bring it down.
Or you can even keep it in a bowl or a jar with water, tender coconut water, anything. Basically, we don't want the teeth to become dry.
Okay.
So you can put it in a liquid like milk or tender coconut or plain water, or if there is a primary healthcare center close by, or if the school has an infirmary, then you can also place it in saline.
Okay.
So, but this needs to reach the dentist at least 60 minutes from the time it has fallen out.
Okay.
Of course, there is a chance for us to put the teeth back into the mouth, but if it is before 60 minutes, there is a very good chance that the tooth becomes normal.
Very good result you will get.
Yes.
See ma'am, after that this portion is fixing there, or whole teeth fixing there. See, after fixed it, what kind of result, how much will be the result? Is it properly working, or before what is happening? What kind
All
of functions?
that depends on the age at which this has occurred.
Yeah.
Usually it is the front teeth which pops out.
Yeah.
So if it is before 10 years, then there are chances that the treatment process will take very long. But if it is after 10 years, we say that the root apex is closed, then the treatment duration is less. But if the tooth is brought in a solution and not dry, and within 60 minutes of tooth coming out, the success rate is very good. We usually put the teeth back and splint it and do a root canal for it and save the tooth in the person's mouth.
Okay.
And the success is very good.
Okay. See, this, when the portion of teeth is fixing there or pasted there, that after 1 or 2 years we can see that there is a color changes are going. Why it is happening?
So sometimes what happens is the tooth piece which is brought was brought dry.
Yeah.
In such cases, this kind of discoloration can happen. If it is brought in any solution and it is not allowed to dry, it may not happen. The other reason is whenever teeth fractures, to human eye we can only see some portion. There will be some micro cracks that are leading to a tissue called pulp, which is the only vital tissue in the tooth. So whenever there is a fragment that is fixed, there will be some insults that continue to happen towards the pulp, because of which the pulp becomes non-vital, or in general terminology to say the tooth becomes dead. But we don't consider that as failure, because even in that situation, when the patient is put on regular follow-up, we can do a root canal and save the teeth in the oral cavity.
Okay. So how to apply root canal in, especially in children case, ma'am?
Yeah. So root canal is a procedure where the dental caries is reached the pulp.
Okay.
So this procedure can happen for milk teeth also, as well as permanent teeth also. So when it happens in permanent teeth, it is called as root canal treatment.
Okay.
But when the same thing happens in milk teeth, it is root canal treatment, but the terminology used is pulpectomy. But the process is just like adult root canal, but it's a simpler process than the adult root canal. So root canal treatment is done for children quite successfully, like for adult patients. But most people tend to shy away from root canal treatment because children are uncooperative. Like any other root canal treatment, when you do root canal treatment for children, we need about 2 or 3 visits, appointments.
There also 2 or 3 visits is enough.
Required
that one.
for
Okay.
milk teeth also. So the children may not want to come back. Children cannot sit for a longer duration, and also that the children will be uncooperative. Because of all these reasons, most parents hesitate to get root canal treatment done for their children. But these things can be dealt. When you see a pediatric dentist, they know how to manage behavior. They also know how to manage the pulpal issues in children. So it can be accomplished quite successfully, provided you see a pediatric dentist. For a general dentist, it becomes little difficult to handle the children, whereas a pediatric dentist can do it very successfully.
See, See, ma'am, we heard that chewing gum helps us to reduce the tooth decay. Is it any scientific support that one, or simply saying chewing gum when we are using chewing gum?
Usually what we do is, like I told you, there is a disease process called as early childhood caries. So when early childhood caries is seen in children, lot of teeth are decayed. So the saliva also has a lot of microorganisms that can cause further decay in other teeth in their mouth. So in such children, or children who are undergoing orthodontic treatment, such patients, or if the child has a lot of defective teeth, in such patients we ourselves recommend use of chewing gums. But there is a way to use it. It is not for just like a habit. It is meant to give saliva some properties which can prevent further caries. It does work because it stimulates the flow of saliva. So when fresh saliva comes, there are more minerals that can cause remineralization of some of the cavitations, as well as it can boost the salivary function to fight against dental caries. But this should not be used generally. Like it is advertised even in televisions that it can prevent caries, but this is not for everyone. It is specifically if the child has a lot of caries and the dentist assumes a role of preventive program, and then the dentist is recommending that you can use chewing gums and for a duration of time. It is not like you start using chewing gum and you can continue to use it and you will never get caries. That is a wrong understanding of this.
Okay. See, even sleeping time, children are making grinding sound. That one, is it common? Is there a treatment for that one?
Yeah. So this has become a very common problem, not just in children, even in adults, where there is a grinding of teeth. And
so most probably this sound will producing only in sleeping time.
Yes. Individuals do chew their teeth and grind their teeth in the daytime, but when you are in sleep, it becomes so annoying that either the parent sleeping by the side of the child says that I can hear a lot of noise, I am worried whether the teeth will fracture. It can happen. And this is sometimes attributed to the school and school stress also. But preliminary, what we would like to do is we would like to deworm the child so that the grinding can stop. But if it continues, we can do treatment in such a way that we can prevent the tooth fractures, and we will give them any appliance that can be worn at sleep comfortably, so they sleep well and they don't grind and damage their teeth.
See, ma'am, why it happened?
Like I told you, it could be because of worms. So we prefer to send them to a pediatrician and get a deworming done. This helps a considerable amount of children that we see with the grinding habit, but some of them continue to have grinding habit even after deworming. Then it could be probably because of the school stress. They have a lot of homework, lot of activities, or there is a lot of pressure from the parents for the child to perform well in school. These kind of factors can induce stress in children. Although it appears that how can children be stressed, but these days we see a lot of children having such kind of stress, and because of which they manifest as grinding habit in children.
Okay, see, we have discussed various types of decay and its treatment. See, actually how to protect the teeth, ma'am.
Yeah, so that is the most important thing. Most of the dental caries that we see in all our population is preventable. So if you want to prevent having dental caries, there are just 2 or 3 important things that one needs to follow. It is, first important thing is, what are you eating? If you are eating too many things continuously, or if you are eating chocolates and biscuits very frequently, confectionaries, such food can damage the teeth. If you are consuming a lot of cola or beverages, carbonated beverages, they tend to damage your teeth. So one component is about what we eat. The next thing is what we do after eating. So after eating any food, if the person is into a habit of gargling the mouth, swishing the mouth, even with plain water, and additionally good if one can brush their teeth. and maintain good oral hygiene, then we will not see dental caries.
Okay.
But in small children, what happens is, for reasons numerous, they don't brush their teeth well
properly. Okay.
and they have to go to school for 6 hours. Parents can't pack too many tiffins, or they have different kinds of snacks. They share snacks at school. So when we have situations like this, neither the diet nor the oral hygiene is completely under the control of parents or school. In such situations, I recommend that the children are brought to pediatric dentist, because we can do something called as fluoride treatment, which is done depending upon the type of cavities the child has, or depending upon the oral hygiene the child can maintain. So we have an agent called as fluoride, which can considerably reduce the amount of caries in children, which we apply in our clinics for children, so that they can benefit from not having caries.
Okay. See, ma'am, we can see that there are children are mentally retarded. See, actually they cannot frequently come and visit the doctor. Such a situation, how to give the treatment?
Okay. So we see that there are several conditions in childhood, like one of which you said, mental retardation, because of which children don't even go to normal schools. They go to special schools.
Correct.
So we consider these children specially abled. Now they cannot maintain good oral hygiene because they lack that kind of mental IQ, or they even lack manual dexterity. So in such patients, when you visit a pediatric dentist, the first thing they do is they can do all the dental treatment for these kind of children under general anesthesia. So when the child is put under general anesthesia, their total oral rehabilitation can be done. But thereafter they are going back to their own condition for the rest of their life. So what we do as pediatric dentist is that we will advocate some oral hygiene method that is suitable for every different condition.
Okay.
So we will tell the parent to use different kinds of oral hygiene aids suitable for their child, so that they can maintain oral hygiene. So they can prevent further dental problems for these kind of children. We also see that there are some children who are very badly behaved, or they are absolutely not cooperative for dental treatment, but they have a lot of root canal treatments to be done. So it becomes very challenging for us also to deliver treatment at times. We also can do dental treatment for these patients under general anesthesia. So all their dental problems can be addressed at one visit. So if any patient finds it difficult to come frequently to dentist, or if the child is uncooperative or has any medical underlying condition because of which they cannot take dental treatment frequently, all these treatments can be done under general anesthesia.
Okay. മെഡിട്രാക്കിൻ്റെ ഇന്നത്തെ എപ്പിസോഡ് ഇവിടെ വൈൻഡപ്പ് ചെയ്യുകയാണ്. ഈ എപ്പിസോഡിൽ കാസർഗോഡ് ഡിവിഷൻ്റെ പ്രേക്ഷകരോട് സംസാരിച്ചത് മാംഗ്ലൂർ ജ്യോതി KMC ഹോസ്പിറ്റലിലെ പീഡിയാട്രിക് ഡെൻറ്റിസ്റ്റ് ഡോക്ടർ ദീപിക പൈ ആണ്. എല്ലാ പ്രേക്ഷകർക്കും നന്ദി, നമസ്കാരം. താങ്ക് യു മാം.
നമസ്കാരം.